If you have low testosterone, you might not realize this, but look at these things if they are available. Do you have low libido? Like you don't have appetite for sex every time. Do you have issues with to do with the ED? Like you try to erect and sometimes you don't erect. Yes, you could be having the libido, but you can't erect. Do you have issues with semen? You are not producing. Like you are a man, but your woman is not getting pregnant. Stop blaming your woman. It could be you with a problem. Do you know that it could be an issue to do with belly fat? You know belly fat? Like to have a fat around your abdomen. And for you, you think you're growing fat or you're getting more money. It could be a sign of something which is more serious. Fatigue and tiredness. You know, shrinkage in your penile tissue. You find that your penis is reducing in size, or even your general body is reducing in size. This could be signs that maybe your hormone that we call testosterone is becoming low. So now let me take you through what low testosterone means and how we can go about it, because this is not a serious issue. Everyone can go about it. It is something that you can treat by yourself without going to hospital. Now, testosterone is a hormone which is responsible for three major important things. One, sex drive, what we call libido. I want sex. As a man, you're supposed to be erecting, not this normal erecting, like every time you're supposed to be erecting. As a man, there's no reason why you should see a woman, you admire the woman and you don't erect. As a man, you're supposed to erect in the morning. You should have morning erections. You should have these random erections. That is very, very important. No, that's one. Two, muscles. This hormone is the one which is responsible still on muscles and energy production. So this one still helps a lot in what? In our muscles. So when you see a man who is stronger, just know that sometimes their testosterone are very okay. But that doesn't mean that you can be a little look fat and your testosterone is very fake because you are obese. You get? So most of the times, muscle development or proper muscle development is a sign that you have proper testosterone. Then we can't forget the production of sperms. Production of sperms. Now, there are some people who could be thinking that for them, as men, they can't be having a problem with fertility. A man can as well be infertile because you have poor production of sperms. Like your sperms, which are supposed to be some 15 million, you are producing like 5 million or 2 million sperms, which could not impregnate the woman. So that means that you have an issue with your sperm production, which could be a result or which could be a problem from low testosterone. So this is very important to know that these important three factors could influence you for your entire life when you are not aware or when you don't have knowledge about the testosterone hormone. So let's look at if these issues are disturbed, what really happens and how do we solve it. So your libido becomes low. You could as well have issues to do with erection. You have PE, ED, you know, you can have those issues. If it is this, you can have shrinkage in your penile tissue, shrinkage in your muscles. Generally, you become small, you become weak, you become fatigued, you become what? Because of the low testosterone. This one is also important. When this one is having a problem, we have talked about how it can affect you. But still, don't forget that you could develop depression. You could develop depression and poor focus. So you realize I have been okay. I have been focusing properly on my work. I have been doing things in a proper way, but I have started getting, you are not okay. You don't have any specific reason why you're depressed. You don't have any specific reason why you lose focus and you forget easily. Like your memory is becoming very short. It could be an indicator that your testosterone levels have reduced. And now let us see, how can we manage this problem? Literally, we know that this problem can come due to one, aging. So as we age, sometimes this hormone will reduce. So you can't expect a testosterone of a 24-year-old male to be equal to someone of 80 years. That's why you will find these things I have told you in all the ages, shrinkage, belly fat, and what and what and what. But we can fight this. So usually we find it in aging. 2, we find it in obese people. So when you know you're very fat, just know that one is also a problem. So when you are obese, you need to work on that. Work on obesity. Do exercises. Go to gym. Exercise. Have good diet. The diet which is rich in the diet which is rich in zinc, the diet which is rich in elements and other ions which are very, very important in production. We talked about these foods, and we talked about the watermelon. We talked about ginger. We talked about mulondo. We talked about small garlic. We talked about beetroot. We talked about many things in our previous videos, and we say that these foods can help you reinstate your testosterone hormone if you use them correctly and rightly. Don't put a lot of ginger, it can irritate the gut and you end up getting gastritis. So this one also needs to be worked on this way. Make sure that you do exercises, make sure that you be part of the team that is fighting obesity and aging as well, because as you do exercises, you can't develop what you call a belly fat. This belly fat is a very well sign. A belly fat is a very good sign that you are having low testosterone. Don't allow this belly fat to come. As you fight it, your testosterone levels stay engaged in the real medication. Then some other things. We talked about medications. There are some medications which cause low testosterone. For example, steroids. So if you know you are this person who is using a lot of steroids, maybe to fight pain, maybe to just have some energy. There are some people who use them just without any reason, or maybe you're having some other disease. Please opt to other medications, to other ways of fighting that particular condition, which is making you take some medications which are causing that. I have given you an example of steroids. Now, we can't forget the issue of illnesses. Illnesses can also cause low testosterone. I'm taking an example of diabetes. I'm taking an example of liver disease, kidney disease, etc. Now, if you know, or if they diagnose in the hospital and they tell you the problem you're having this and this and this, it is because of this, please make sure that that disease that is causing low testosterone, or that is causing this premature ejaculation, erectile dysfunction, and whatsoever, make sure that it is controlled properly. For example, diabetes. Make sure that you're taking the medications properly, and never forget the principles. We have to keep doing exercises. We have to keep screening. Then, meanwhile, there are some other pituitary disorders and others which need involvement of the doctors or of the professionals. So, with that, when you work on your exercises, have a good diet, fight the belly fat, make sure that the aging is not part of your plan. Don't allow to age, because we have been teaching about how a man can protect himself against these aging defects that usually come along with age. Make sure that the illnesses you have are controlled. The rest of the things will be in order. Make sure that you eat the foods we always teach about, and this testosterone will be in order. See you in our next video. Bye.